one of the most common urological problems. So a lot of the audience listening to this are going to be urologists, and the thing that they would most come across with sickle cell patients are sickle cell priapisms. Have you suffered with priapisms in the past?
Yeah, so I've suffered with priapism for many years now. I remember my first priapism sort of occurring whilst at university. I was about 19 or 20, I would say. Waking up in the middle of the night with this real, this pain, obviously, in my penis, which was really uncomfortable. First time, never experienced it, not really knowing what it was. I just thought, maybe I just can't sleep. Kept me up all night, and I just didn't know how to deal with it. And yeah, so I've been, and ever since then, it wasn't until the subsequent sort of hematology clinic that I went to that the question was asked, am I having painful erections at night? And that was when, sort of it clicked that, oh, so this is actually connected as a complication to sickle cell disease. And it was like, oh, here we go, another problem, and another doctor that I'm going to need to see, another referral that I need to have. So that was the first time, and I've had it since then.
Yeah. I mean, so as you mentioned, even though you knew about the sickle cell disease, or it was diagnosed at a young age, you were never kind of really forewarned, or never aware of this as a possibility until it really happened to you first time round.
Yeah. No, I wasn't told at all that this was something that could potentially happen, and how to deal with it, what things could help, if there are any sort of preventative measures or anything like that. So I've really had to sort of navigate this whole priapism initially by myself.
And tell me, what was the kind of typical pattern that you got with your priapisms? How often were you getting them, and how were they affecting you?
So I was getting them in a typical week, 5 or 6 nights a week at university. And it literally sort of sapped the life out of me. So much exhaustion, because I was waking up in the middle of the night, doing intense exercise. So I'll be, up doing press ups, high knees, just anything to try and get the blood flow away from the penis and, circulating around the body. And, I was successful. When I started doing that, it would help. And, after about a good 30 minutes of good exercise, I'd be able to go back to sleep. But then an hour later or an hour and a half later, it would come back, and back up again. I was doing intense exercise, trying to get this erection to go away. So I was exhausted, totally exhausted, even through my employment as well. Exactly the same problem.
So Andrew, how many episodes were you getting a night?
So a typical one, I'd wake up at about 2 a.m. in the morning.
Yeah.
Start exercise. I'll be back in bed by 3 a.m. And then I would wake up again, let's say about 5 a.m. doing another round of exercise, and try and get back to sleep, let's say about 6. And then obviously because of working, university, I would have to be up at, let's say, 6:30, 7. So that's what it was. That was the continuum on a daily basis.
And you were getting that for about 5 nights a week. And for how many years, were you in this kind of situation before things started to improve?
I would say it probably was about, I'd say 5 or 6 years before finally things started improving. So initially I was referred to a urologist initially, who started me on atelafrin. This was like in a joint clinic with the hematology team. We started on atelafrin, to try and get the blood away from the penis again. And whilst it did help, I was on quite a large dose. The benefits were very short-lived. And I was experiencing terrible side effects. I was experiencing really severe palpitations that I'd never had before. So I said there was no, after, I did persist with this treatment as well, but after a while, the palpitations got the better of me and I just couldn't continue. So I just decided to stick with, doing the exercise. But it wasn't until I was sort of referred to your clinic, jointly, with the hematologist, that oxygen therapy was introduced to me. And so at this point, it's probably been about 5 years of having this, and having the oxygen has really improved the experience I'm having.